If you are just joining us, please tell us who you are and what org you're with. Oh, wow, I see so many people that we know. Hi, Scott. Oh, it's been too long. Gosh. Oh, there's Lindsay, our data person. Hi, Lorelai. Trying to see who else is in here that I know. Julie Bank is here. Hi, Julie. Oh, Jen Browse, another very challenging shelter. I hope this can be very relevant to your org. Becca Edwards is here. Amanda Foster. Oh gosh, I see so many folks I know. Welcome everybody. We are going to get started in just a minute. We're going to let a few more people join. If you are just joining, please let us know.
Oh, it's so good to see so many old friends here.
I know. Who do you know? Who do you see that you
I
know?
know. I
Teresa's,
know Jennifer Browse. I know Lorelei. I know Becca. I know Julie Bank. I know Cindy Burnham. I know Brian Whipple. I
Jackie's.
know a lot. I know
I
most everyone
know. It's a
here.
lot of friends here.
Yeah.
Uh,
It's gonna be a lively conversation.
Yeah, thank you all
Um,
for coming. We hope this is the first of a couple of different webinars about this because it is a huge topic. We're going to go ahead and get started. Welcome, everybody. My name is Kristen Hassen, and I am a animal shelter helper with Outcomes for Pets Consulting. And got to work with LA Animal Services last year and this year, thanks to support from the ASPCA, who is why we're all here talking about this today because they supported a project to let us try to help bring what I consider, if not the toughest, one of America's toughest animal shelter systems to a humane capacity for care. And I am here with my friends and colleagues, Annette Ramirez, the assistant or the interim general manager for LA Animal Services, and Dr. Kate Hurley, who needs no introduction but is with UC Davis um, and really instrumental figure in bringing veterinary care and animal sheltering together. And so, Kate, I don't know if you want to start by introducing yourself and talking a little bit about what you do.
sure, I can introduce myself real briefly. I'm with the UC Davis Correct Shelter Medicine Program and have been since its inception. But I think most relevant, maybe, I was the first person in the world to do a residency in shelter medicine. And the reason that I undertook to do something that seemed a little bit insane at the time, because I didn't know if it would go anywhere or not, was that I worked as an animal control officer for 6 years before I went to vet school. And then I worked as a shelter vet for a couple of years before the possibility of the residency opened up. And I felt like the work we were doing in shelters was so invisible to the veterinary profession and just to a lot of the world. The struggles that we were having were just internal to our own world. And it felt so important to open up a connection between what was happening in shelters and what was happening in the rest of the world that was relevant and could support what we were trying to do. So my goal really was that nobody in a shelter would have to feel as alone as I did when I was an animal control officer and like didn't know how to stop parvo or distemper or upper respiratory infection from spreading among the animals I was caring for. So I have a lot of answers to that question, but that's the one that
Hmm,
comes to mind
That's a
today.
good one. Annette, tell us a little bit about you. For
So, Annette Ramirez, I'm the interim general manager for LA Animal Services, and I've actually been with Animal Services since 2000. So, as you can imagine, animal welfare during those 25 years has changed dramatically. When I started for the department, I actually started as a kennel attendant. So I was in the kennels cleaning and helping the community and eventually became an animal control officer and worked our animal cruelty task force with LAPD, where we investigated like the most egregious animal cruelty crimes like dog fighting, cockfighting, and severe abuse cases, and got to see those cases go through to their prosecution and saw oftentimes how animals languished in the shelter during the time frame that it took for an animal cruelty case to be adjudicated in the court system. And I eventually moved my way up into the management role. And I think my experience, both as an animal care tech and as an animal control officer, just really helped me with understanding the roles that our different staff members have and the challenges that they face. I totally understand where they're coming from. And I think I'm in a really good position to try to help with mitigating a lot of those challenges and moving programs forward to expedite like release of animals.
Thanks, Annette. We want to just put it out here from the beginning that we're just three people out of virtually thousands of people and organizations who help and have helped LA Animal Services. There are organizations like the ASPCA, Best Friends, Petco, and so many others. Michelson. I will forget names if I even try. So many organizations and individuals that have been instrumental to helping LA Animal Services over the years. And we're just three of them. And so we're going to primarily talk about our own experience, but just want to make sure to mention there's so many people that are helping, including local groups, local rescue groups, volunteers. They are the key, the volunteers and fosters at LA Animal Services. And last but very important, Dogs Playing for Life. Also there because of the ASPCA, and making sure that dogs don't lose their minds while they are sitting in shelter, sometimes for quite a long time. Okay, so we're gonna get started. Just this is an older, I think this is 2022 data, and I don't have an updated version of this, but we just wanted to point out that this is a graph that shows different big municipal animal sheltering systems. And you can see that LA Animal Services at the time had an 86% live release rate. It's higher now. But you can see that it was one of the most underfunded large animal shelters in the nation, and it continues to be. Funding is a huge challenge. Most people who walk in there couldn't imagine doing what a caretaker does at LA Animal Services every day. When we were there, there were two caretakers to clean about 300 kennels, many of them with multiple dogs in them. So it is such a challenging environment for everybody that works there, and an organization that bottom line needs more money to do what they do. So if you're not familiar with Los Angeles, it's down here in this lower left corner, all that red stuff. Los Angeles is huge. About 13 million people in the metro area, and about 4 million of those live in the city that is served by animal services. So it's a huge population of people, and actually the per capita intake isn't all that high when you consider that. Because there's so much work that happens in the community and so many organizations doing spay neuter, and helping in other ways. Annette, do you want to tell us what we're looking at here?
Yeah, so that's a map of Los Angeles and basically where all of our shelters are located, which are very much spread apart because it is only six shelters that serves about 500 square miles. So if you were to travel from our harbor shelter to the West Valley shelter, it could easily take you 3 hours to get from one location to the other. So, and then depending on LA traffic and what's going on with any traffic accidents, it could take even longer. So it's just, this is really just a large span of an area, and it also goes to show like how close we are to other organizations as well, because we are just six shelter system, but there are multiple other shelter systems around us as well.
Yeah, thank you. There's interwoven in here. You have LA County shelters, Long Beach, several other animal shelter systems, but these shelters are each an hour apart in most cases, right? Like you couldn't
Yeah.
make it to each of all of them in one day. Okay, so September 2024 is when we sort of a group of organizations and individuals came together to address what was happening at LA Animal Services. I'm going to ask both of you to speak to that in just a moment, but just by the numbers, in September 2024, there were about 1,400 dogs in care each day, housed across 6 shelters, but the total number of kennels was only 750. So they were more than doubled. At the South LA shelter alone, there were about 450 dogs. As we'll talk about, there should be about 200 there, and so they were way over capacity. And it was they had it, it's actually 250 dogs with the length of stay, longer than 90 days. I don't believe it was longer than a year. I need to update that. 150 dogs were living in pop-up crates in the hallway, and this was the thing that I think was most upsetting to a lot of folks. The animal care staffing, it would be one caretaker for 75 dogs up to one caretaker for 200 dogs. Really challenging, way, way, way above the guidelines from NACA. There really aren't dedicated adoption counselors, so it's the animal care staff helping with adoptions. And as we said before, the system is really underfunded. So I'm going to just stop here on some of the photos that we saw in our walkthrough. And these aren't particularly horrific, but they all are very indicative of what we saw. So I want to ask Annette, can you talk a little bit about what the situation was when you came into, when we all kind of came together at LA Animal Services?
Yeah, so when the teams of organizations that came to help us stepped in, we invited them in, and that this is how we were trying to draw attention to what was going on here in LA, was opening our doors and inviting people in to see the conditions because they truly were inhumane. We had more animals than we could properly care for. We were housing animals, multiple animals in hallways. The dogs were staying in their crates for 23 and a half hours out of the day. The only time they were let out was when we were cleaning their crates, and their crates oftentimes were not cleaned in a timely manner. So they were stepping in their own waste, and they would be covered in waste themselves. And it was their green water bowls, as you can see. It was like we were not able to keep up with the minimum standards of animal husbandry. And it was causing a mental health crisis for the staff. It was something that was very difficult, I think, for staff to come in and day out, seeing the conditions that the animals were in and not being able to do better for them. So we knew that we had to make a change. It was not acceptable for the animals. It was not acceptable for the staff. We were having multiple severe dog attacks and bites, and that was actually one of the final like alarm bells that went off, is that we had a 24-year long employee be severely mauled at one of our facilities, by an animal that we probably shouldn't have been housing, because of the safety concerns that that animal had displayed. And we were holding on to dangerous animals. It wasn't just, the highly adoptables that were being held in these conditions. It was potentially extremely dangerous animals that we were just not moving through our system. And it was just completely inhumane, like I said, for the animals as well as the staff and volunteers to be subjected to these conditions day in and day out.
Yeah. Dr. Hurley, you and I were there with this group, and I think, at the time we felt like Annette needed reinforcement. And I want to say that her boss, also Deputy Mayor Hamilton, was right there with us. So it wasn't like the leadership of the city didn't see the problem too. And I think they felt like they needed support from folks to come from outside and just look at the situation. Can you talk a little bit about what you saw when you came in and sort of how you explained this to elected and appointed officials that we met with?
I'll do my best. Um, and I want to reiterate, this is like a no bad guys scenario. Nobody was slacking. Nobody was uncaring. Nobody intended for this to happen. And yet, this was the inevitable outcome of a system where there was no mechanism to balance intakes with outcomes and with the ultimately limited capacity that every organization faces in their ability to provide humane and safe care. And I mean, you can hear it in Annette's voice. You could hear it in every single person's voice who worked at that shelter. When we came together with the elected officials, it was about risk management, and it was in response to the severe bites that had happened. But what I wanted to urgently convey is that that was the inevitable tip of an iceberg of suffering. And this was the guaranteed outcome of the system that was in place. And it was a situation that had been building one or two or three dogs at a time for a period of 3 years or more. Really, since the big reset of 2020, one by one, week by week, just one or two dogs more came in than left. And there was no mechanism, there was no permission, there was no mark to hit to say, okay, we got to rebalance it now. Would have been easy in week 1 or week 2 or week 3 or week 4. Even in week 10 or week 15 would have been pretty easy. But here we were in week 150 or so of a situation of more in than out, a little bit at a time. And it was resulting not just in these big dramatic bites, but day by day, you can see the pictures of dogs sitting in crates, not getting out for days at a time. Not just dangerous dogs that shouldn't have been kept, but adoptable dogs that shouldn't have become dangerous. Not just understaffed, but staff so burnt out that they couldn't come in, and when they did come in, they couldn't work. There was an inability to even assess what the animals needed because their true behavior was invisible underneath the layer of crowding and suffering and noise and smell and chaos. And it was at a point where it was creating a cycle that just continued rolling further and further. And I have seen it at steps before this, and I have seen it several steps down the line after this. And as bad as this was, it felt so urgently necessary to communicate to all the powers that be, like, let's stop this before it goes there. And if the there that I've seen that's even worse than what we saw could have any value, could it have value here to say, like, let's stop now? And let's stop in a way that doesn't have to be like, let's euthanize a whole bunch of animals that didn't need to be euthanized. Let's put into the hands of this caring team, this team that I know, the tools that they need to balance intake and outcomes. And it's ultimately simple. And this is just the metaphor that resonated with the powers that be, I think, is like, it's like spending. You can't spend more than you earn. And
Yeah.
if you spend a little bit more, like, okay, you pay some interest on it. It costs you a little bit more to get all the things if you're always spending on credit. And like on a Monday, you're going to take in more animals than leave alive. But if they don't balance out by the following Sunday, then you're spending even more than you need to. In an underfunded system, you're spending extra. And this system wasn't just being managed to like high interest rates. This system was being driven to manage to bankruptcy. Individual decisions couldn't be made until animals had catastrophically deteriorated or gotten ill. And population balancing decisions couldn't be made until there was an outbreak present or other catastrophic things were happening. And so ultimately, it was about just like, how much do we need to spend? And how much can we earn? And how can we give the system permission to balance on an individual level and a population level before we hit that credit limit, before we're paying those interest rates, before we're dealing with the consequences of bankruptcy?
Thank you. Yeah, and we're primarily talking about balancing the dog population because it was and remains the primary crisis during most of the year at LA Animal Services. But there's a lot of silent sufferers here that also couldn't get what they needed because there really wasn't enough animal care staff. When we were there, I was there in August as well, and there were just animals everywhere. Like they were coming in faster than they could even process them into cages. And it's true, the staff and people were working their tails off to move animals, but there was nowhere to put them. There were so many bunnies in care for a long time. A lot of these guys, a lot of this was an outcome of that situation because the right amount of attention couldn't be paid to these animals, so then they started to add up too. It's important to say that Allow was also working well relative to other large animal shelter systems, and thanks to the help of so much life-saving support from best friends and so many organizations who've really emphasized life-saving in LA over many years. There were things that were working really well. Dogs Playing for Life was there. The volunteers are so committed and amazing, working tirelessly to help animals. There are a lot of longtime staff and a lot of systems because I work with shelters all over the country. We see a lot of turnover to the point that there's no institutional knowledge left. It's not true at LA. There's a lot of staff who know how to operate in this environment. Super engaged community, and just lots of people committed to helping. And like from the top down in leadership and the government, like they met with us. That is not always the case. Like people did want to help solve it and knew there was a problem. So we're going to talk a little bit about what we did. And by we, this was really a variety of organizations coming together. The role of my organization was to bring them all together. We set out to decide what needs to happen now. So this was a group convened by the ASPCA in September to meet and look at what do we need to do right now. And this is where I hope this presentation becomes really useful for those of you dealing with the same thing. It really helped to get everyone in the same room. We knew we needed to reduce big dog length of stay. We needed to reach a humane capacity for care. Dr. Hurley was key to this meeting and talking about what that looked like. We knew we needed to increase safety. There were a fair number of severe bites. They almost were always happening, getting animals in and out of kennels. And that was because the stress level was so high. Everybody knew that we didn't want to compromise on the live outcome rate if we didn't need to, but we were talking about really serious actions that we might need to take, such as, emergency intake only for a period of time. We didn't end up having to do that. And also, how do we get to really meeting the guidelines set forth by the ASV guidelines? Because we were, in many ways, they were cleaning, but they were cleaning so fast they couldn't use rescue. Like, so they couldn't use cleaning solution. They were literally just spraying out the kennels every day at some of the sites. So these are a few of the things that we did immediately. We established volunteer meetings every other week. And these were remote and included everybody in the solution. And they were just like blunt, here's where we're at, here's what we need, here's why it's hard. We started having weekly pathway planning meetings and operations meetings that they hadn't had, really focused on moving animals. We implemented an at-risk dog outcomes process, which Annette and I are going to talk a little bit about. We looked at what the internal barriers were, and there were a lot because it's a huge system. And we pushed to allocate more resources to getting animals out. And finally, we created a new intake protocol that allowed for some triage. So, Annette, can you talk a little bit about, you and I really did this side by side, figuring out how do we, in an organization that had never said euthanasia for space, even though that was what we were looking at, how did we get from not talking about that to this protocol, which we will share with you in the chat. Hopefully you can read some of this, but Annette, can you just give a quick overview of this?
Yeah, so we basically had to wait till an animal was displaying severe behavioral issues before we could make a euthanasia decision. And that was part of what contributed to the bottleneck of animals or dogs not leaving our facilities. So one of the things that we realized with population balance is that euthanasia is one of those things that does have to be utilized, but being able to be transparent about animals or dogs that are at risk, really due to space constraints, would would increase their life-saving chances because currently or prior to the at-risk protocol, we were only able to say, this isn't a good dog. It's got behavior issues, and that's why it's at risk of euthanasia. Because it jumps and barks in its kennel. It does the thing that dogs do, as opposed to just saying, this is a really good dog. We're just out of space. So we had to really socialize this concept of letting the public know when animals were at risk of euthanasia due to space, to be transparent with the community and potentially increase their life-saving chances because there was nothing wrong with the dog. It was just that we didn't have the ability to provide them with the space, and there were more dogs coming in the door. In order to socialize this, we really had to work with our council offices, our commissioners, volunteers, our staff. I mean, we really talked about this protocol for probably about 4 to 5 months before putting a pilot into place. So we really wanted to get people's input, make sure people understood what we were doing was trying to increase the life saving for those dogs that were at risk due to space only. And, having that transparency with the community and give the community the opportunity to help us. Because previously we were basically telling them these aren't good dogs, don't come get them, which was not the appropriate message. They needed to know that they were good dogs, and really it was just that we don't have infinite space, and we couldn't continue on the trajectory that we were currently on. So it did take quite a bit of time to just socialize this and discuss it with all the different stakeholders because we wanted to make sure everybody understood that we were trying to increase life saving, and that by being transparent with the community that we really did feel that it would increase the adoption opportunities for a lot of these dogs that were sitting in care, um, not being seen because there were so many animals in care.
And I'll just add to that. I think we use the term euthanasia for space. We don't actually use the term like pulling other. Sometimes we do. We say we're having a free adoptions because we're out of space. But space is always shorthand for an imbalance between intake and outcomes. We're not actually euthanizing for space. Because if we could avoid euthanasia for space by creating more space, by holding 50 more dogs or 100 more dogs or 200 more dogs or 500 more dogs or 3,000 more dogs, then we would do that. If we could eliminate euthanasia by creating a certain amount of space and staffing that space, we would do it. But it's because there's a chronic imbalance between intake and outcomes. That's why we end up euthanizing or going to emergency only intake or making everything free or putting out emergency calls to transfer partners. All of those things that seem driven by space are driven by an intake outcome imbalance that needs to be corrected. Just like if you're going on credit card, ultimately, it's not that you don't have a high enough credit limit. It's that there's an imbalance between what you're spending and earning. So I think we can talk about it as shorthand, but I just want to clarify. That's why when we say euthanasia for space, people say, why don't you just like create more space, house more dogs? It doesn't work. We know logically it
Yeah.
doesn't work. We just have to keep bringing it back to that.
Yeah, it's really an important point, and one that I think we this next slide really speaks to. So we proposed an updated org chart. The thing about LA shelters that are challenging is most all of those shelters are bigger than most of the shelters any of us will ever run, each one individually. They're all massive. Yet they haven't had managers to oversee them, and so they're run by sort of a group of supervisors with the management structure being outside of the organization. So the other thing about them, I was going to show the old org chart, but boy, that's its own webinar. They haven't had any real dedicated staff to just outcomes. It's like the animal care techs do that. Annette, why don't you explain? This is your organization.
Yeah, so we don't have any staff that's really dedicated to matchmaking or adoption counseling. Really, it is the Kennel attendants that are on the floor cleaning the kennels and providing water and attending to the animals are also answering questions in between, stepping out of a kennel that they just hosed or squeegeed out. And we didn't have anyone really dedicated to knowing the personality of the dogs and being able to have those conversations with people to understand their lifestyle and make appropriate matches as to their lifestyle. So basically people would walk around our kennels kind of lost and looking at the dogs who oftentimes were overstimulated and overstressed because they weren't getting enough enrichment. And I think that makes it very hard for someone to make a very good adoption selection. And even with that, we have great adoption numbers. So I could just imagine us being able to dedicate adoption counselors or matchmaker staff, how much better our adoption numbers to the public would be. We do have one person at every shelter who works with rescue partners and fosters, but it's one person for each of these facilities, which, it really is not enough to be able to just process our rescue adoptions on any given day and be able to provide support to foster parents and answering any questions that they might have about the health or care of the pet that they have in foster care. So there is pretty much zero follow-up that's done with foster volunteers. They get this animal, we send them off, and it's kind of like, hopefully you find someone to adopt it, or you choose to adopt yourself. But there isn't a lot of support that we are able to provide with the animals
Right.
that are in foster care.
And a lot of these, so this animal flow and outcome supervisor, this is all part of the recommendation. Most of this hasn't happened yet.
Yeah.
I want to point out that like there is still a lot of room for change to happen. This org chart has not been realized. It's just piece by piece we're getting there. We also looked at internal barriers. If you do nothing else after leaving this webinar, do this for your own organization. You meet with volunteers, you meet with staff, and you say, what are the things we're doing that are slowing down outcomes? And you will be shocked. In the best, fastest moving organization, you will be so surprised at how many of the things keeping animals in your shelter are because of you. Because of that one bad thing that happened in 2007. Whatever the reason, these were just a few of the barriers that we learned about at LA. We won't get too much into these today, but a lot of the challenge was that a lot of the animals that were the most highly adoptable were held off public view. They couldn't be seen or accessed by anyone, including just like minor medical, little dogs, things like that. And so those would bottleneck in the back kennels until somebody moved them up. That's true at a lot of your organizations. It's still a problem. The more animals you can get on public view so that people can see and access them, at a minimum, so that volunteers can see and access them, the faster your system moves. Annette I don't think this has changed, right? Annette, you cannot waive fees for uh, reclaim or adoptions, or has that
It
happened?
has changed. It finally went through our Board of Commissioners and our City Council and got mayoral approval. So I'm finally able to waive redemption fees and waive adoption fees. So we've definitely been taking advantage of
Oh,
that.
that's so great. They were
Yeah.
really high too. Like the reclaim fees were really high. That's so awesome to hear. So great.
And I think that's just such a good illustration of like when a shelter is in crisis, our minds go to this dark place of like we have to euthanize now a bunch of animals. But you balance the credit, to go back to that credit card analogy, you can either spend less or you can earn more. And for decades, the shelter system's hands have been tied in terms of one way we know of earning more, getting more live outcomes, which is waiving fees. So we can open these pathways when we grapple with the reality that we can't just infinitely expand the population and just not deal and hope something will change somehow.
Yeah, that's such great news. Okay, so we're going to show you just a little bit of data and then we're going to get right to questions and discussion. when we think about intake and outcome balancing, we can see that we are in 2025, this data is through June. But we can see that we're pretty close to a balance again, and that we haven't decreased the live release rate significantly. And that was something that's really important to everybody to see. I think they're going to end the year above a 90% live release rate. Um, and cats, similarly, the live release rate in 2025 was higher. You see a population imbalance here for cats because it was that June period when we pulled this data. So that imbalance is just kittens probably hanging out in foster care waiting to get adopted, but that has balanced out since. Here are the like high level outcomes from the project. And again, this wasn't just our work, this is a lot of groups and individuals working together. But the canine live release rate between January and June of 25 is almost 92%. We saw the length of stay decrease. This is really attributed just to paying more attention and to having that at-risk dog process. It went down throughout the system, even though our work was primarily focused at South LA, it went down throughout the system by 11 days from an average of 28 days to 17. It went down a full 20 days. It was 37-day average length of stay when we started working at South LA down to 17 days. And we really we hit hard on those long stay dogs, making sure those dogs that are getting bottlenecked are the ones we're putting the most emphasis on. And you will recall if you were in LA or probably not even in LA that the fires really helped us out. They gave us a pretty big boost, and that's as they were horrific. I survived the fires myself. But the thing that happened is that a lot of the orgs came in and pulled a lot of the dogs, and some of the long stay dogs left too. So that was a terrible thing, I think, for everybody in LA to go through. It did have the consequence of getting more dogs out, and so it really helped us jumpstart this idea that we weren't going to house animals so long. Annette, do you want to add anything to that?
Yeah, no, the community really stepped up during the fires to our rescue partners pulled all the dogs that, were available, pulling a lot of dogs that had been in care for a really long time, and a lot of people showed up to foster. And that was extremely helpful too. We didn't know how many animals we were going to get from the fire area, so we wanted to make sure that we had space to house them and we didn't have to euthanize in order to do so. So the community really stepped up, and it was really heartwarming. And I think the community always does that around emergencies, that they do come and they support the shelter. They want to make sure that we don't waver on our life savings. So it's always really great to see how engaged the community is during the times of need like that.
I'll just add that I put this in the chat, but just for people who are listening in, um, one thing that is true is that once you work to the way we calculate your optimal capacity, which is a number that we gave to the LA City Shelter System, is based on your optimal length of stay. Once you get to that optimal capacity, it will drive the optimal length of stay. It will sustain it if you work to that optimal capacity. Same with being at double your capacity, it will drive double the optimal length of stay. So in our calculations, we already knew that the length of stay would drop to 17 if you could get to about 280 animals in care. It works magically.
I think
It
this is
works in the reverse too.
I think this is a good time to talk about what UC Davis did and what you came in and did. And I think if Dr. Hurley, we're looking at some of the dog occupancy meters, and the thing that has stood out to me is that that first one, gosh, that's from October of 2024. That actually was lower. I couldn't find a screenshot, but a month earlier it was like 1,400 something. It has stayed below 1,000 for the most part since you did the capacity for care assessment. Can you talk a little bit about can you just give us like I think we've already decided we need a part two so you can lay all this out, but can you tell us just a little bit about how you did the capacity for care assessment for South LA?
Yeah. And I can share a few slides if you want, or I can just talk about it. Essentially, what we do is we looked at 5 years of data to see what we could predict in terms of the animals needing to move through and what the historic imbalance had been between intake and outcomes, and what was sort of the best that we could expect the system could do in terms of length of stay and to make sure that they could achieve a really strong live release rate at the level of length of stay that we recommend, which is, this is going to shock some people, 7 to 14 days average is the length of stay to aim for. That is what gets the fast track dogs out within just a few days and make sure you have plenty of time for the dogs that need more time, but you're not wasting time waiting for dogs to deteriorate or waiting for crises to strike to allow reactive decisions to be made. When you make proactive decisions, a length of stay of 7 to 14 days is optimal. And what we saw was that in 2018, with much higher intake than was happening in 2024, a length of stay of 11 days was maintained with a live release rate of above 89%. So we knew it could be done. So we made recommendations based on maintaining a length of stay of 7 to 14 days. And then we gave them a housing number and we looked and made sure it matched with the housing, that the housing could be
Yeah.
used. So we didn't mandate co-housing when it wasn't appropriate. So we didn't have to use isolation for adoptable animal housing or quarantine for sick animal housing. We'd use all the housing appropriately. And we gave a number. And it took us many, many hours to calculate that number, but we also are available to help you all get that number because I think it's important to know, like, what credit limit do we need? And not just keep increasing the credit limit, but just say, like, okay, we need some credit limit because, like, we have to spend some things before we can earn some things. But beyond a certain amount of debt, it's not helpful. And so to just have a solid number to say, like, okay, that's the max. Now we got to get things balancing out, I think can be really, really helpful.
Yeah, and I think I want to just go through the rest of these and come back to this because I think people are gonna have questions about it. Dr. Hurley, is that okay if we can just
Yeah, that's I'll answer in the chat as best I can
okay.
and also talk about that a little.
Bites were a pretty big deal. This really, we were seeing a high number of moderate and severe bites. That's the thing that our team was probably the most concerned with. They had gone up and up. And so we really wanted to see, can we get those bites down? And here on the right, you'll see this graph that kind of shows it all in one place. So we're looking at two periods, January through June 24 and January through June 25. And 24, they were still really quite high. And what we saw is that as the length of stay went down, the bite rate per thousand dogs also went down. And we also saw a significant decrease in moderate and severe bites. And Annette, has that held true as you've kept population down? I haven't seen any updated bite data, but my understanding is you're still at a lower, and we're primarily concerned with those moderate and severe bites because you guys do play groups, so minor bites happen. But do you know if that has held?
Yeah, it definitely has held. We haven't had as many severe and moderate bites. We still do have minor bites, but at one point we were dealing with one bite at least every 1 to 2 days. So it was very frequent that we were having bite incidents in the shelters, and that's definitely been reduced.
And this is probably a good time to mention Dr. Emily Weiss, who somehow hasn't come up, who was going to be doing this webinar with us, but had a slight conflict. Hopefully, we'll be on the next one. But she's really the person that had us looking at the right data points. Dr. Weiss is a big part of why this project happened as well. But she was really helped us hone in on what is the data that's most important to know. And this was a huge one because all of this work started with one really terrible dog attack that was probably, preventable had the shelter not been in the situation it was in. So thanks to her. This is my favorite graph ever. AI, if you're not on julius.ai and you're a data nerd, go sign up now. It's so amazing. It helps you look at data in ways you never thought of. But I love this. I love this first graph because it shows the difference in the population. So, in reducing length of stay, we wanted to tackle those longest stay dogs. And so you can see here that we have this major change that starts to happen in the beginning of 2025, where we're pushing out the long stay dogs intentionally. And so we have more dogs that have been there less time. It's safer. We know the animals are moving, and this is what, with Dr. Hurley, paying attention to the population balance rather than just how full you are. This is where it becomes critical. Because of Dr. Hurley and capacity for care, we were like, okay, we know that that one kennel that's had a dog for a year, that's a lot of dogs that could be moving through the system. So that one really, that one really was an important point. And then finally, we looked at the decrease in length of stay of all the different outcome types. So down here you can see these are different kinds of outcomes. New Hope are rescue partners. And in most cases, the length of stay to outcome decreased. There's a couple exceptions here. Best Friends is in here. And I believe this is because they were pulling dog animals that had been in the system longer, which is great. So some of these went up for specific reasons, but in general, the length of stay to all outcome types was going down. So I'm going to stop sharing now and get to some questions. I was hoping there would be recommendations, action steps we can implement in our shelters. Are we going to get to that? Okay, you guys.
So for me, I think the important thing is to determine what your capacity for care is, because without that, you're blind. You don't know how to balance your population and what triggers you need to pull. So it really is important to determine what your capacity for care is. And then if you don't already have like an at-risk protocol that provides clear transparency, implementing one of those, because since we have implemented our at-risk protocol, we have been able to get a lot more, increase our life saving. I think we're at 91% right now for dogs. And I think that does have a direct impact from the at-risk protocol and just being transparent with the community as to the reason that animals are at risk of euthanasia and really communicating that out with the community. We brought this protocol to public meetings on several occasions and have made it a very public document. So I think it's really important to socialize that and have that discussion with your city officials, with your rescue partners, your staff, and your volunteers. They're all part of the equation.
Thank you. Dr. Hurley?
Yeah, I concur with that. Great to have your number to work to. Um, and then I think daily population rounds, the most important thing you can do, even if you don't have your number, like just pick a number. Even if you can't do population rounds perfectly, you can't have a team, you can't do the whole shelter. Pick, pick an area, pick a wing, pick a ward, pick a line of kennels, do it. Do it with two people and start there. And even if you're starting too high, sort of hold yourself to like at the end of the week, if there was an imbalance of even one, decide how to address that imbalance. There are three ways. The following week, you can either take in one fewer than leave alive. You can get one more live outcome, or you can make one euthanasia decision. So this is much easier to make when it's just one or a few. So even if you're starting too high, start balancing intake and outcomes. And then in any week where you have a few more outcomes than you have intake, your population is lower, your staff is less stressed, there's more time, then you can invest that in getting it even a little bit lower and a little bit lower. So in the same way that these populations increased over time, you can decrease them over time. The other thing that you can do is one big population reset immediately frees up a ton of resources to make the population intake and outcomes balance in more positive ways on an ongoing basis, to give you more time for population rounds because you're now staffed at 1 to 30 instead of 1 to 70 or 1 to 200.
Yeah.
So if there's a way, if an opportunity comes up, if you can demand that population reset, if you can call, just like say, hey, like we just want to do this one time, big adoption promotion, big return to home promotion, everything is free. One time to get your population back down, that really helps to kickstart everything. But if you can't do that, population rounds, chip away at it, and no longer tolerate one more in than out on a week by week basis.
I was a pretty big critic of capacity for care, and I've even written about it. And I think my worry has always been if we have a number in the shelter and people just say this is the maximum number and we have to euthanize when we get above that, that would lead to just more bad outcomes. And I have seen that happen. Like some shelters have done that. However, that's not what I think you teach, Dr. Hurley. And I think going through this process with you and UC Davis, the thing that it did is it got everybody working towards a goal and actually understanding animals can't live here. And Annette said before the webinar, like these places were not built for animals to live. And it's true. They're awful, awful places for animals to spend months. Um, and it got everybody because there was so much focus on life outcomes, and there's still so much to do. Like this really, I think we've done step one out of like, or we've done like the first two steps in a series of 10. But it got people thinking about movement. And I think what I'm seeing a lot of in shelters is we're treating them like horse boarding stables, where it's like we're going to go in every day, we're going to take care of the horses and make sure everybody has hay and water, and then we're going to go home at night. And it is the wrong way to look at the problem. It's like we really need to be thinking about movement first. Like these are like hospital beds in a hospital. You can't just get full. You have to keep patients moving. And the same thing is true here. And that's really what it did. And it's made it really clear that until we set a goal for staff and volunteers, nobody knows what they're working for. It feels like this like endless grind. And that's where I think it was so valuable to do and a process really everybody should go through to define like what is actually humane. We have a lot of questions. How can we start to bring volunteers in as support for adoption counselors, matchmaking? You guys do that, right, Annette?
Yeah, and that's basically what we have to rely on our volunteer program. And we have a huge volunteer program of volunteers that are super supportive of the department and really dedicated to us. And the volunteers are able to provide the enrichment to the animals and they get to know their personalities. So we really do rely heavily on our volunteers to do that matchmaking and support people when they're coming into the shelter looking to adopt or foster an animal. It would be great to have the staff doing it because, volunteering, as you know, some days you have a lot of volunteers, some days you don't. During the week, some of our shelters only have one or two volunteers in the kennels where during the weekend we may have more. So it would help to have staff being able to do those, being dedicated to those positions so that we would have consistency in when that service is available.
One thing that's really amazing about LA, and I want to just say, I think we have a lot of gratitude for LA Animal Services, and Annette, you've led this culture of transparency. Like you're out here talking about it, you're being totally clear. It is still one of the hardest shelter systems in the nation. You guys are publishing all of your data every month. You have a daily population balance calculator. Check out LA Animal Services. They have this daily population balance thing, and it's showing did we have more intakes and outcomes today? Like you're saying this to the public every day, and it's scary because it opens you to more criticism. And we know that that's a whole other webinar, another whole webinar. But you're getting the job done, I think, because you're talking about the problem. Do you find that the more you communicate transparently, the more help is showing up for you?
Absolutely. I think that the more we are transparent in, our challenges and our successes, we're able to get more organizations and more community members to follow us and support us. Um, uh, but with that being said, there's a lot of work still ahead for us. we still have so much work to do. We are still extremely underfunded, and utilizing a lot of the reports that were produced out of this collaboration, I'm basically trying to use that as leverage to help me in budget requests, because it goes to show that we need, adoption counselors, we need foster coordinators, we need these positions that are outcome driven. Right now, we are so only reactive to providing care for animals that are in the shelter, but we need to be more outcome driven, and we need to like shift those resources, but we need additional resources in order to be able to do so, to get to that starting point. So I'm definitely using a lot of the information that was gained from this collaborative to make my budget requests and identify the positions that we really need. And, I don't expect the city to give me positions. If I'm asking, I don't expect to ask for 100 positions, but I'm doing it little by little. Let me get adoption counselors at every shelter, and then next time let's go for foster coordinators, and slowly build upon that org chart that we were talking about. That is, we've been able to identify where the needs are, and now we just need to get the resources to fill those needs.
Yeah, thank you. And it's important to mention that intake hasn't gone down. This is not a shelter. Actually, they need to do more probably to manage intake more effectively. This is generally a shelter that does take in a tremendously high volume, one of the highest volumes in the country, one or two in intake. So it is a massive number of animals moving through the system. And I think the goal here is to move them more quickly so that they can all be served, and so that the ones, right now, a system like LA Animal Services, they have the ability to save animals with medical conditions. They do a great job treating, like they get, every time I'm there, I'll see an animal come in that like a lot of shelters would just euthanize. They are treating those, but in order to be able to treat those animals, they've got to have the space to treat them, the literal space to treat them, and that's what they're creating here. And I just in my la I want to give you both a chance to give some last words. I want to say that, like, again, we're just three people who came in and made a what we think is a fairly significant impact into the system with lots of help from others, but there's a lot more to be done. And I think the thing about the lesson from LA Animal Services is they didn't just roll over and say, this is how it's going to be. They actually asked for help. They were so humble and welcoming of that help. And that is the right thing for all of us to be doing. It's like never to just be saying, this is what we're stuck with. And we hear so much of that nihilism in the movement right now, and we gotta stop. Like, we have to stop just saying we can't do it, and we have to start thinking, how can we adapt to this new world we're in? So, I want to give both of you a chance to say any last words that you have to share with this group. And thank you so much for everybody for chiming in the chat. It's just an interesting conversation.
Yeah, I just want to add that, as for shelter directors, that there is help out there. There's a lot of organizations that are willing to come together to provide the support that you need, to make the choices and the decisions that absolutely need to be made for your staff and for the animals in your care. So definitely reach out. There's a lot of support out there for you. And I was able to tap into that. And I am so thankful for all the orgs that did come to help us here in LA. And, we had been crying that there was a crisis, and it took outside agencies to like confirm what we were saying in order for a lot of the city officials to hear us. So I'm really grateful for the support that came out of this group.
And I'll just add that there's some comments in the chat about what about the animals that are turned away? And I want to acknowledge there are no easy answers where we get to spend as much as we want to spend and buy all the things, even when that's more than we're earning, right? There just are limits. There's limits to capacity. And there's not an easy answer where LA City Animal Services can provide everything that's needed for every animal at risk in the city, especially in a time where there's a veterinary workforce shortage, there's an access to spay-neuter crisis. People are facing housing insecurity at higher and higher levels. There are tens of thousands of animals in need. Holding 250 more in the shelter is devastating for the ability of the shelter to address those resources in a sustainable way, to give the person what they need if they have an unaltered cat or an unvaccinated animal, to control public health, to support people to be successful in caring for their animals. Making these decisions quickly, using an at-risk dog protocol, working to your capacity for care isn't going to mean you have enough for all that you dream of doing, but it means you'll have more and you'll have less suffering along
Yeah.
the way. And that can create a virtuous cycle where you can get more volunteers, you can get more staff, you can get more support, and then you can do more bit by bit.
Thank you, everybody. Thank you so much for coming. We're going to do a follow-up. I think we already talked Dr. Hurley into doing a follow-up webinar specifically focused on calculating your particular capacity for care and how this worked in LA. So you'll hear more about that soon. And we want to just thank, on behalf of Outcomes for Pets, so thanks to everybody for coming. We're doing these webinars because we think this information is so important to get out there and really get out the word that if the toughest shelter system in America can do something to make their situation better, we all can. So thank you all for attending. It's great to see so many of you here and keep doing the amazing work you're doing to save lives and help animals in our shelters and communities. Have a great day, everybody.
Thank you, everyone.
Bye, y'all. It was so good to see you.